Welcome to today's webinar, How Healthcare Companies are Disrupting the Industry with Personalized Environmental Data. Before we get started, I wanted to go over a couple of housekeeping items. Today's session will be recorded and emailed to you afterwards. There will be a Q&A session at the end of the webinar. In order to ask questions, please use the Q&A panel that can be found when you click on the Q&A button at the bottom of your Zoom screen. That is opposed to the chat. On today's agenda, the challenges facing healthcare and pharmaceutical companies, disrupting the industry to enhance connectivity and data science insights, real examples, industry opportunities, the benefits of disrupting the industry, and of course, your questions. Today's webinar will be hosted by Uri Schechterman, our Head of Business Development and Strategic Alliances Americas. Take it away, Uri.
So thank you, Ronit, and thank you, Edith, and the rest of the marketing team for organizing our fourth webinar. Much appreciated. So much went on behind the scenes here, so it was greatly appreciated. So just a quick recap for those of you who are joining us for the first time, and for those who have listened before. It won't be more than 2 or 3 minutes just to recap, but at Breezometer, basically our goal is to provide awareness about air pollution, air quality, pollen, basically making the invisible visible and actionable as well on a personal level. So we provide personalized, actionable data on air quality. The data that we provide is based on big data and machine learning, and we have a multidisciplinary team of environmental engineers, modeling specialists, and big data specialists as well. What do we actually do? We provide a simple API. We're a B2B company providing real-time information about air quality index, pollen conditions, personal recommendations, pollutant concentration levels, heat maps on a visualization sort of way, which we'll talk about later, as well as weather and fire information as well. So I'm going to try to talk about the personal nature of air pollution and pollen, how it affects us. If you were to take 100 people, put them in the same exact spot outside, exposed to the elements and pollution and pollen, whatever that may be, each one of them would actually be affected differently. And pollen and pollution really have personalized effects on us. So for example, on the short-term effects, it could be headaches, it could be sneezing and coughing, etc. And that's often caused both by pollen and by air pollution. And sometimes we do not actually feel the effect right away. It's something that lingers in our system. It could lead to chronic illnesses, whether it's heart disease or lung disease, but it could have a long-term ramification. So you may not notice it right away, but overall exposure after a few years could really lead to those illnesses. And it's affecting everybody differently. So we'll talk about that more in depth later on, and how it's affected, but really elderly, young, pregnant women, athletes, each one of us has different symptoms and different effects by air pollution, which is why it's so important to really engage and fully explain that.
Populations, Uri?
Absolutely. It's in case we did not hear the question. It's the same for both sensitive and non-sensitive populations. So for example, in my house, one of my kids is allergic to pollen, tree pollen specifically, to birch, but nobody else is affected. But if we're both exposed, let's say, to air pollution, to something else, some of us may feel it right away, but others may not. Each one of it is affected differently, but nobody would ever go out and say that air pollution is good for you. So it's affecting all of us, some more than others, but it's affecting all of us. So one of the challenges that we see facing pharmaceutical companies, health companies, behavior modification companies, etc., is the following. It's all the W's essentially. Who are you targeting? When are you targeting them? And what treatments are you offering them? So let's use pollen as a simple example. There could be a time right now that, let's say, in Austin, Texas, juniper may be the active pollen, and those who are allergic to juniper would be affected by that. But in the same time, in Minnesota, birch or maple may be the active pollens there. So if somebody's allergic to juniper in Minnesota, they will not be affected, but somebody who's allergic to juniper in Austin, Texas will be affected. Obviously, somebody who's not allergic to juniper at all will not be affected at all. So one of the challenges I think that companies are having is to know Who are they targeting? What are they actually suffering from? How can they recommend them the right personalized treatments? And how can they provide like the efficient, marketing, budgeting, allocation? Where, today's in digital age where you're trying to hone in so specifically on your target audience, how do you know where to target them and how to do this? And even when you do target them, it's very important not to have one of those one-size-fits-all scenarios. Not everybody is affected the same way. And too many companies, I think, in the past have been looking at it as a one-size-fits-all scenario, and they're realizing that this has to be personalized on a much more, let's say, pinpointed level. So that's one way. It's the behind the scenes, but also the engagement elements, and to enhance essentially the engagement level and to reduce the churn rates and lack of loyalty. Let me show you a quick video right here, and I think I may have shown a different one before. But this is just to show you how dynamic air pollution could be. So this happens to be in Los Angeles, and you could see the ticker on the top left side of your screen showing the time, and you see it changes dynamically every hour. Red is bad, green is good. This is actually the air quality index during the fires in Los Angeles. And you can see how some areas are really under hazardous conditions, while others are green, and they can be just 4 or 5 miles away, completely different scenarios. If I were to put this, let's say, in terms of temperature, just to put things in perspective, and I'll use Fahrenheit because I see that most of the people are from the US that signed in, so maybe I'll do Fahrenheit and Celsius. It's kind of like going from 20 degrees Fahrenheit to 120 degrees in literally 2-3 hours. That's how dynamic it is. In Celsius, I guess, will be from -10 to 35 degrees in 2 or 3 hours. So basically, the future of connectivity, what can we do about it? So number one, the trends that we see and many of the people in the industry are doing is to get connected. Get connected could be to a device in terms of an IoT connectivity on the one hand, and on the other hand, sometimes the treatment itself, it could be medicinal, it could be others, may not necessarily be connected to a device, but because everybody's carrying a mobile phone, that personal engagement is available right there and then to describe the situation and to discuss the symptoms on a connected level. And on a personal levels, you really have the ability to increase the personalization based on data. It could be, some of it is based on data that you yourself, company, may have directly with the consumer. Sometimes it's data that can be enhanced with an API from an outsourced company, providing more hyperlocal information about that, which obviously could make the difference in terms of the layering and distinguish us or you from the competition.
So what you're saying, Uri, is that basically these companies can take the data about their users, or provide their users information about the data in the world around them to give them that personal experience, or really get to know their personal environment.
Exactly that, and that's exactly what we're seeing right now, because the ability to connect with your customer is really dependent on so many various conditions. So obviously we provide weather data, fire data, air pollution data, pollen data, but everybody's affected differently. So your personal environment and your personal experience are really affected by that. It's not, you said it nicely, it's a hybrid of the personal environment and the personal experience. And that's really the best way to connect and engage with the customers. I'm going to go through, we're going to go here through a bunch of examples about how to better connect and personalize with the patients or with the consumers. But really, let's start with the visualization element. I mean, it's talking about the visualizing it, but also the 360 point of view and engagement. So let's start with the basics of visualization. If we look here, Ronit, do you want to just...
Exactly as you said, Uri. And imagine I'm the user right now, and what I'm showing you is the Brisometer app. And I'm typing in here now a location in Canada. And what I'm going to see now is I'm going to see the air quality around me. As you can see, it's good. It's telling me I can go outside. It's showing me the most prominent pollutant, but really right now it's quite low. It looks like it's pretty healthy for me to go outside.
It's also showing us this, I think it's showing a nice segue. I think we talked before about the heat map, because this is your own personal experience.
Exactly.
kind of going on the heat map and start zooming in and out of it.
Exactly. And so as you can see now is that this specific city that I searched is actually right next door to the fires that are happening in Canada right now, in Alberta. So it's really fascinating that once I can go in, I can really get an idea of what's going on in the environment around me. I understand that I'm breathing healthy air, but it's an amazing thing that I can see that right next to me, the air quality is dropping as it gets closer to the fire. But as I come out, I see I'm in healthy air again, just by looking at this visualization.
That's perfect. I think what we're seeing with so many situations right now in the market is that the visualization is kind of the segue to really get to know and better understand air pollution and its effect on us. And it's fascinating because you showed before, I think one of the pop-ups that we saw was explaining exactly what the pollutant concentration is and what's the cause and effect. And we see that, all the time, that people are trying to better understand what it is. They start with the heat map and then they move on to other things. And what we provide on the heat map specifically is the hyper-local locality of it all. The data is exceptionally granular. We got grid points in every 500 meters in 93 countries around the world. And one of the things we're trying to do here is to enable you to provide that data to your consumers so they can see for themselves, so your patients, they can see for themselves what the air quality around them is, if it's moderate, if it's low, what are the specific pollutant concentrations that are affecting them. You can see here on the left side, which says good air quality, that ozone is actually more dominant. And ozone is typically something that affects kids 14 and younger. So perhaps overall the air quality index is showing a good number, but kids 14 and younger maybe need to be a bit more aware about the conditions and what they can do about it. One second. We're getting information that we're getting. Can you hear us? Okay, you can hear us again? Okay. We're back on audio.
So you're getting really personal with this level of granularity.
Absolutely. So, and that's exactly the point, to get personal with the granularity, to follow the person wherever they may be, and provide them with that data. And once you provide them with that data, it's really about behavior modification that sets you free. And I'll give this example of a partnership we had with Mount Sinai Hospital. The concept was very simple. If you make asthma patients aware about the outdoor air quality conditions in New York, how would they behave? Just the heat map, just the air quality index. And what we saw was a major reduction in asthma attacks and major reduction in hospitalizations as well. But the fascinating part of it was that the increase in actual user engagement, not just indoors but outdoors, meaning the amount of time spent outdoors increased dramatically as a result of knowing just what the outdoor air quality conditions are, because people are afraid sometimes to go outdoor because they assume that the air quality may be bad. But in fact, especially, maybe, I guess in big cities, that's a concern a lot of people have. But there are plenty of times in the day, maybe more often than not than people think, that you can actually go and enjoy life and live life and enjoy it outside. So that's one major trend that we see in terms of visualization and enabling the user to understand as a segue how to move forward. The other important element here is really brand awareness. Many companies are now trying to capitalize on that brand awareness on a personal level. So for example, here in this use case, we see L'Oreal with a nice app that they have, My Skin Track, connected with an IoT device, which measures the UV exposure. So the idea is to show the relevant and personalized location information and provide specific treatments to that. So if you've been exposed for too long, whether it's to UV or to pollen, which obviously affects the skin for those who are sensitive, or air pollution, which could cause eczema and other dryness of the skin, etc., you can provide them with instantaneous personal recommendation as far as what they can do about it, just basing it on their exposure. Because somebody may be outdoors for 5 hours in a day, and another person can also be outdoors for 5 hours, but they could be in completely different locations with different air quality conditions, different pollen conditions, and therefore their recommendations would be completely different as a result of that. So it's one very easy way to personalize engagement in that case. I hope this video will play. We had some technical issues before. I'm just going to press play now, and I'm hoping it's going to work. So I recommend that you guys take a look at this a bit later. I'm sorry, it seems like the audio once again may have gone, but let's just talk about that. The idea is to adapt, to allow people to really properly focus. All right. I don't know if the video worked or did not work. We've got different response. People can hear us and cannot hear us. So I'm just going to move on. Yeah, live. Everything is great when you go live, right? So a live webinar has its pluses and minuses, but we'll share hopefully the links later on so you guys can see it. But again, let's use this example with CapCode. CapCode has a device to make for asthma patients, to make their inhaler connected. And the idea is really to track the overall environmental exposure, both in terms of weather conditions, pollen conditions on a personal level. Where have you been exposed to? Based on that, you can start identifying personal triggers. Some people may not be affected at all, let's say by exposure to PM 2.5 for 3 hours, but once they start hitting 5 hours a day, on certain levels, it starts affecting them. The person themselves can start registering their symptoms and learn about that, but the company as well. So overall, you can do a lot of research and data science correlation work on the back end to better understand and identify triggers, both in terms of population segments and in terms of personal triggers for each person. You can talk about behavior modification and adherence in terms of following your medication and treatment usage. You can know when to have your inhaler ready and when not to do it. The idea is really to own it, to manage your daily routine year-round and use it for user engagement. I want to talk again once more about pollen, because pollen is a bit different than air pollution. Air pollution is a bit more dynamic, more on an hourly basis, because pollen is typically caused by nature. It is dynamic, but more on a daily basis. And it's heavily affected also, obviously, by weather conditions, as it has to do with vegetation, land cover, and so forth. So for example, on a rainy day, you'll have much less pollen in the air because it would reduce both pollen and particulate matter. On a humid day, actually, oftentimes that causes an explosion of pollen outside because some of the pollens expand as a result. So the idea is to really provide that personalized, information. And I think, Ronit is a huge fan of ALKs and their app, so she's going to take it over from here.
This is actually a really amazing app, Uri. You're right, I am a huge fan, and it goes to what you were just saying about the pollen changing daily, and also it affecting different people in different areas and the levels being different in different areas. So ALK has this pollen tracker app that shows you the pollen levels in your area, the pollen calendar in your area, and it includes, as you discussed, weather and air quality, because both affect the pollen and the way that the user experience their symptomatic responses. As you can see, it shows more about the pollutants. It's a really in-depth app. It's super engaging, and it has a really special feature where the user can log in their allergy symptoms. As you can see, it asks what kind of hay fever symptoms bother you the most. Now, the user, as well as ALK, knows that on this pollen day with this level of pollen, this user experienced these symptoms, and they experience the effect of if there's effect of cross allergies, if the way that it affected their daily lives, their skin, what kind of treatments that they have, and it can get really, really personal. So as ALK themselves puts it, it's a personalized allergy companion.
That's amazing. And just to put things in perspective, one of the things that we found when we go to pharmaceutical companies using data, pollen data specifically for research, oftentimes the research has to correlate to the symptoms actually shown by the patient. So if you're talking about allergy medicine or allergy treatments, people actually want to see some correlation between the so-called modeling of pollen conditions and real-time symptom displayed by the patients. So here, for example, it says with brisometer, without brisometer. Actually, this is an example we actually did that shows with weather and without weather. So the bottom image is actually without the weather data, and the top is with the weather data, just to show how the weather actually affects the heat maps in that regard. So the idea is to really provide the user engagement and personalization, but also from a research perspective, to study correlation, to get some data science going behind the scenes to understand what are the triggers that can affect and therefore develop treatments as a result that would be relevant to the various populations. So we got 7 population groups in our recommendations that we put together, and I say population groups, not demographics, for a reason. These are people with heart disease, people with lung disease, pregnant women, athletes, children, elderly, and also the general public. And each one of them can be individually affected differently by specific pollutant concentrations. So for each one of these 7 groups, there are actually 4 different recommendations for each of the pollutant concentrations, from hazardous conditions to good conditions. Because we have a few minutes, I want to talk about Propeller like a use case, but I want to show their video because I think it actually shows a really nice example of what they can do about it. I'm just going to play the video now. I'll talk it over if nobody can hear the audio. Hopefully it'll work. If you have asthma or COPD, so basically the idea is to show, unfortunately the audio is not playing here, but that's what happens on the live. But the idea is to obviously the person suffering from asthma and is trying to do whatever they can to avoid dealing with the situation here. And what Propeller Health has really developed, and this is one of the partnerships with us, among other sources of data that they're getting, is to really provide you with the confidence and the information as far as what you can do to better manage your life, letting you know exactly what the conditions are at any given point through the day, what your symptoms could be, what the forecast will be for the rest of the day. So you can really manage your life, be in touch with your doctor, and own up to your COPD situation or asthma. And what they've seen from their studies is that it's 70% fewer attacks. The numbers speak for themselves. And as you can see, it's about unshackling yourself, freeing yourself, using that data for that personal treatment to really live your life and move forward and enjoy it.
Really a great success story for personalization.
Absolutely. Hold on one second. Here we go. So I'm sorry for the audio not working. We'll try to put it out together in the email afterwards when we put it together. So at the end of the day, when we're talking about the benefits of personalization, I think I would say it's the behind the scenes, but it's also the engagement level. But it's all about personalization. At the end of the day, behavior modification and cost reductions are key here, because by patients knowing exactly what the conditions are and being able to deal with the treatment over here, they can reduce their asthma attacks, can reduce allergy attacks, and obviously spend more time with their family and loved ones, or from a company perspective, go to the office, less missing days at work, more productivity. It's also in helping companies conducting research, whether it's clinical trials, clinical research, to understand better correlation by fully understanding the outdoor air pollution conditions and understanding the pollen levels outside. And when I say pollen levels, we can break it down even to the levels of which type of pollen are we talking about. Not just trees, grass, or weed, but 10 different types of trees and what they are. It helps you from an engagement perspective provide product differentiation, increase patient trust and health because you're in ongoing communication with them, letting them know what they can do about it, making them aware about the hazards ahead or the great air quality conditions ahead, and do something about it. And again, increase engagement and adherence overall. So the idea is really to move from like being product-centric to really being customer-centric, which could be I guess that's the ultimate benefit over here.
Thanks, Uri. That was a really good sum up of it. Just run through quickly the takeaways. One size fits all. It's a thing of the past. Healthcare customers will not wait for you to get personal to meet their needs and sensitivities, so catch up. Healthcare companies can use environmental data to connect better with their users, as Uri said, to go from product-centric to customer-centric. And healthcare companies that have implemented, they are already disrupted the system with environmental data, have seen increases in sales, user engagement, and loyalty. Now, Uri, we actually have a couple minutes for questions, and I see that we have some coming in.
I'm just looking over here and putting on my reading glasses, right? So question number one that we're seeing here, are you able to see any end user data? Great question. Thank you for asking. Our patient information is highly confidential and privacy is extremely important to us. So excellent question. The answer is no. We're not able to see any customer data. The data that we provide is purely one directional. It goes to the client servers, the client server being the company. So for example, if I'm working with the company XYZ, company XYZ just simply puts in the long and lat on the API. They get the information for that particular location. They store that data. We have no access to it. We don't even know what patient this correlates to. So the answer is no. Confidentiality is of utmost importance. We do have quite a few pharmaceutical clients working with us, and then we know that that's something that has to be adhered to. So that's the simple answer. Yeah. Okay, next question. How can your data show end users when to take medications? It is hard for users to interpret your data. So the simple question is, we're not asking the users to interpret the data. The data is provided to our customers, the B2B customers. So we have some very basic general recommendations based on the 7 groups. But at the end of the day, it's the health company, whether it's the healthcare company or the pharmaceutical company that decides based on the different pollutant information data that they're getting, what recommendations they should be recommending. But oftentimes, I think we've seen that in some of the cases, the users themselves can start identifying certain triggers based on the air quality conditions. So for example, if it's a humid day, I don't know, in one patient's case, I saw one example of that. The person identified, the patient themselves figured out that when on a day that they happen to be allergic to maple, when maple levels are high and it's a humid day, they seem to suffer far worse from allergies on that day, so they want to pre-medicate themselves ahead of time. That's just one example of how it's being done. It's about really identifying the symptoms and the actual pollutant concentration levels in the air. Okay.
Thanks, Uri. I see we have a couple more questions about implementing with our data. Please feel free to reach out to us, info@brazometer.com, and we will follow up with you regardless directly to answer any and all of your questions. Well, we've come to the end of it. I want to give a big thanks to Uri for helping us out today and hosting us today's webinar.
And Idit, I think, and to Idit and Ronit, this is our 4th webinar. We didn't have any technical glitches on the first 3, and every conceivable glitch that could have happened like an hour before it actually happened. We lost the Wi-Fi connection, we lost the microphone, but everything is working perfectly. Great job.
Thanks again for sticking with us. We really enjoy bringing you these webinars. Stay tuned for the next one, and we'll see you there.